Consider this, a tale of two cities right here in Jacksonville, Florida. Community A is a healthier, walkable, fast-growing place with amenities and a great school system. There are white-collar workers that work from home and active age 55 and up seniors. They have healthcare services and resources like a fitness center right in their neighborhood to maintain and improve health. The average life expectancy of the residents of Community A is 80 years, and most of the residents are white. Just a few miles away is Community B, with stark differences. Most of the residents of Community B are Black and look like me. They're blue-collar workers, unable to work from home, and they're more sedentary seniors. Their neighborhood is labeled a food desert because there are not very many grocery stores. And the health outcomes for Community B are poor, with an average life expectancy of 67 years, 13 years difference than Community A. How could it be that communities only a few miles apart have such drastically different health outcomes? It's because 70% of what determines health outcomes is not direct hands-on patient care like your annual checkup, but instead, it's the non-clinical factors like access to healthy food, opportunities for physical exercise, racism, and income. These are examples of social determinants of health. Community A has more positive social determinants, and Community B has more negative ones. As a healthcare executive, I serve both communities. I've led as the president of the hospital that birthed over 2,000 healthy babies each year, and now I lead the hospital that specializes in high-risk pregnancies. And even with all of our resources, the statistics in Jacksonville show that Black babies die at almost 3 times the rate of white babies before their first birthday. And nationally, breast cancer has become the #1 cause of cancer death for Black women, which is alarming because we know when found early, breast cancer is usually curable. As a healthcare leader, I'm charged with and responsible for ensuring equitable outcomes for all people of whichever community. So what should I do to ensure that each person in every community gets the same quality outcomes and has the best shot at having a long, healthy life here in Jacksonville? First, I acknowledge that communities A and B don't start at the same place. By every measure, be it average age of the residents, race and ethnicity, or average household income, which we know to be the most significant social determinant of health, by every measure, the communities are different. So I can't treat them equally. I must customize my approach for equity and outcomes, recognizing that our race-based history that insisted on separate and unequal must now guide our response for a healthier future. I also must consider how the community feels about its own health. In my experience, health is not top of mind for Community B. Top of mind is keeping a roof overhead, keeping the family fed and clothed, just covering the basics each day. And when health is on their minds, it's usually because there's a problem interrupting daily life. And even then, they'll push through the pain, ignore the discomfort, because there's work to do. There's family to care for, or they just don't want to bother anybody. This may explain why breast cancer and heart disease are found at later stages, leading to poorer outcomes for Community B. So, if I'm going to make a difference in health outcomes, I'm going to need to reach outside the walls of the hospital to the under-resourced communities to focus on helping to create economic stability so that community B can ensure the basics are covered. Health systems do a wonderful job at exposing high schoolers to the vast options in healthcare, the great paying careers from physician to MRI technologist. The possibilities are endless. And health systems also do a nice job at partnering with trade schools and colleges to expose residents to training programs like medical assisting and registered nurse programs. So yes, health systems have a role to play, but we can't do it alone. We all have a role to play in ensuring that Jacksonville is a healthier, more equitable community. So you may be wondering, what does the everyday resident care about this? There's a strong relationship between health and economic performance. Healthy communities yield a healthy economy. So if you want Jacksonville to continue on its current growth course, attracting new jobs and new residents, Community A must take an active role in supporting Community B to address the social determinants that impact health the most. So what can we do as everyday residents? We want to help fix the problem. So where do we start? Let's start by addressing food insecurity. In Jacksonville, Duval County has one of the highest food insecurity rates in the state at 20% for adults. And adults that don't have access to healthy food have more mental health conditions, obesity, and chronic disease like diabetes and heart disease. So how can Community A and B help address that problem? We can support community gardens like the one tended by Bridge the Gap at Catherine McNair Park in Brentwood. They're growing potatoes, melons, zucchini squash, just to name a few, and they're distributing the food to their neighbors, along with a recipe book so they know how to cook it. Or you could help support the community cart at Yellow House Art by donating fresh food for neighbors to pick up anytime they need it. Healthy food is medicine, so volunteer, donate, plant your own garden, and give away some of your harvest. Another thing we can do together is to commit to move more, because being physically active helps improve your brain health. It helps reduce the risk of chronic disease, helps manage your weight, and helps improve your ability to do your everyday activities. And if those aren't benefit enough, taking more steps each day helps reduce the risk of premature death, and we all want that. So together, we can infuse more movement even while watching our favorite TV show. Take out your smartphone, line up your favorite playlist, and get ready to dance. Dance as hard as you can for as long as the music lasts, and repeat at every commercial, and watch the steps add up. We can also support the city as they build the Emerald Trail. When complete, it'll be 30 miles of trails and greenways and parks, encircling our urban core and connecting historic neighborhoods like La Villa and downtown to East Side and Riverside. Can you see yourself taking a bike tour to see the public art installations along the trail? Or jumping into a free fitness class? Or stopping into a small business to purchase a pastry? When complete, this will be a major physical connector of communities A and B. Think of the pride and sense of ownership those residents will feel when they see the investment in their communities. They're going to feel like they're included, like they belong. And that same sense of belonging helps boost our mental and physical health for us all. Depression, anxiety, and suicide are mental conditions associated with lacking a sense of belonging. So how might community A and B boost our sense of belonging, especially for our seniors, where loneliness and isolation is such a disease accelerator? Let's start with nurturing relationships with seniors in our own family. I moved my 87-year-old grandmother here to Jacksonville about 4 years ago, and Saturdays is our day to hang out, so she's looking for me today. I call it chore day. And during chores, I often ask her to tell me a story about her childhood, growing up in Navasota, Texas. And when she finishes the story, we both feel connected and grateful. Our sense of belonging to each other is boosted. But it's not enough just to take care of our own. Reach out and find a senior citizen in the community to call and check in on regularly. You'll be amazed at the joy you get from the experience, all while reducing depression, anxiety, and suicide for our elders. We may live in different communities, but we all benefit from creating a healthier, more equitable Jacksonville. The fun and simple steps we've talked about today are one way to move forward, but they're certainly not the only way. Will you do your part in doing what it takes to address the social determinants that impact health the most? Just know that viewing solutions through an equity lens will get us health and well-being for all. Thank you.